Hello. In this short video, I'm going to walk you through the Professional Standard Authority's strategic plan for 2026 to 29. This will cover what we do, our operating context, our priorities for the next 3 years, and what success would look like by 2029. Let's start with the purpose of the Professional Standards Authority for Health and Social Care. The PSA exists to protect the public. We do this by overseeing those who regulate and register health and care professionals across the UK. These are organisations responsible for ensuring that doctors, nurses, dentists, pharmacists and others are safe, competent to practice, and act in line with codes of behaviour. Our role is not to regulate professionals directly, but to hold regulators and accredited registers to account. We review their performance and, where necessary, can challenge outcomes that do not sufficiently protect the public. In simple terms, we are the system's independent check or safety net, making sure that regulation works in the public interest. What about our operating context? Well, the environment we're working in is becoming ever more complex. Demand on health and care services is rising, driven by an ageing population and increasing health needs. This puts pressure on the workforce and on regulators. There are also rapid changes in how care is being delivered. Technology, new roles, and more integrated services, which do not always fit neatly within traditional regulatory frameworks. These factors can increase risks to patient safety. Regulators are being asked, now more than ever, to balance supporting the workforce with maintaining standards. The public, quite rightly, expect transparency, fairness, and swift action when things go wrong. They are looking at regulators and accredited registers and the PSA to make sure we're doing everything we can to protect the public. The PSA delivers its purpose through 3 main functions. First, we assess how well regulators and accredited registers meet our standards. Second, we review fitness to practice outcomes and appeal cases to the courts when decisions may be insufficient to protect the public. And third, we advise on the reform of regulation, share learning, and promote better regulation across the health and care system. Our work must reflect both the similarities and the differences across England, Northern Ireland, Scotland, and Wales. We are strongly of the view that regulation needs to be proportionate to the risks of harm, as outlined in our right touch regulation approach. In many ways, a strategic plan is like planning a journey. Where are we in 2026? Where do we want to be in 2029? And what is the best route? And we need to be able to adapt that route when we encounter opportunities and challenges during the journey. The PSA plan has 3 strategic aims. Strategic aim 1 is to deliver strong oversight to keep people safe. This means making sure that the regulators and accredited registers are doing a good job, so that patients and service users are protected. We will check how well health and care regulators are performing, focus our attention where risks to the public are greatest, and strive to make sure that standards are high across the system. A key part of this will be the introduction of our new standards from July 2026. If regulators work well, professionals are safer to practice and the public are better protected. Strategic Aim 2 is to improve and modernise regulation to make it fairer, simpler and more effective. This means supporting regulatory reform across the UK. It also means intervening to address any areas of underperformance in regulators and accredited registers, and encouraging continuous improvement in these organisations. We will support a more preventative approach to regulation and registration, trying to stop harm before it happens rather than just reacting to problems. And we will promote equality, diversity and inclusion in our work and in those we oversee. Strategic Aim 3 is to support safer care across the whole system. This means working with others to make regulation of people, places and products more cohesive, supportive and preventative. We will encourage the UK governments to develop regulatory strategies to support the safe implementation of workforce plans. We will also work with others to address any areas of over or under regulation in health and social care. We want to see more proportionate regulation, more collaborative regulation, more preventative regulation. Looking across these strategic aims, there are some clear themes relating to how we need to work if we are to support better regulation. And these themes are oversight, good governance, reform, collaboration, and prevention. To get where we want to be, we will need to make best use of our resources, further improve our processes, including making the best use of artificial intelligence, and invest in our people. We also need to work in line with our organisational values: integrity, transparency, respect, fairness, and teamwork. So, if we manage to do everything we would like to do over the next 3 years, and it will be challenging, particularly because we do not know how we will be impacted by external events, what would success look like in 2029? Regulators and accredited registers will be consistently meeting high standards. Fitness to practice decisions will be more robust. The regulatory system will be better adapted to modern health and care delivery. Our work will be influencing policy and practice across the system. And we will be able to demonstrate that the PSA is making a real difference to public protection. In summary, we're going to do everything we can to deliver our strategic plan. The really important outcomes are that we do a better job, the regulators and accredited registers do a better job, and healthcare professionals do a better job in providing safer care for all. Thank you for listening. If you have any questions, please get in touch.